Good morning to all dental technicians here who have time to join me. I'm a user of Ceramill since the very beginning, and I can show you a few pics how it looked like about 14 years ago. And yeah, let's get started. So this is where I live and where my lab is. It's behind my lab, actually, the Swabian Alps, Swabian Jura. And on this nice day, on the one side of the hill there was snow, and on the other side there was actually spring. So very nice area where we live. It's beautiful area, so we can do a lot of stuff since making teeth. When we finished the lab work, we can go outside and have fun in nature. So this is my lab where I'm sitting right now, and some other pictures of my lab. So inside the lab I have it very clear and clean. I have a lot of patients in my lab to do the shade matching and some discussions with the patient, how the new teeth have to look like. So everything has to be clean and in a good way, that the patient feels comfortable, and also it's important that I feel comfortable, because if I'm in a room that I like, I can make teeth that I like. So that's very important for me to have it nice. We are 6 dental technicians in my lab, and we do all the dental stuff since orthodontics. That's the only stuff we don't do. This is a place in the lab where I can also meet patients and docs. And yeah, okay, enough of my lab. I will show you a lot of patient cases. I got 15 patient cases in the next 50 minutes. So let's rock this. This is where I started with Amann Girrbach Zirconium dioxide. It was 2007, and this is the copying machine. Some of you may know it, a lot maybe not, because it's really a long time ago. But I love all ceramics since the very beginning, because I think it's the material that is the best opportunity to copy nature. And in this time you have to modulate the reconstruction with Ceramill gel, and then you do it by hand. You mill it out, you copy the one side what you designed by hands with the Ceramill gel, and then the material decision was quite easy. In 2007 it is just one material on the market at this time, that is ZI white. It's very good that this material is still available, and I use it, not a lot, but in different cases. And after this hour you will know in which cases I use ZI white. Okay, this is a case I did 13 years ago, and in this time the patient wanted new crowns, and you can expect why. It doesn't look very good. So what we did is we had a nice preparation from my dog, and I made this framework. The fitting was good if the parameters of your copy machine was good, but it wasn't good every day, because after a hard weekend, when we did party on Monday morning, the fitting was not so good. On the end of the week, when you are tired, it was also not so good. But on Tuesday, on Wednesday, the fitting was perfect. So I think this was a Tuesday when I did this case. Very perfect fitting here on the margins, and I did a lot of ceramic on it. And then the dog put the crowns in the mouth, and you see the result. It was very good. So there was a way to achieve very good and long-lasting crowns, but the way was much harder than it is now. So after we did this copy milling by hand, we decided to buy one of the first Ceramill MAP 300 scanners. So this is an employee at this time, Marcus, and we designed on one working station, sent to Amann Girrbach, and then we got back this stuff here. These are all packages from the milled zirconium restorations in the lab, and they fitted very good. But the next problem was we had to be in the lab sometimes at Saturday and wait for the postman to get this nice box to get the work finished. So I didn't do this a long time, maybe half a year, and then we bought the Ceramill Motion, and we milled it on our own. This is the way it looks now in the lab. I took this pictures for you a few days ago. We have 3 working stations. We have here on this picture, you see a MAP 400 and a MAP 600. Next working place is also MAP 400, and in the background you see a printer, you see the Motion DNA, you see the Motion 2, and we also have the old Motion 1, which we use for Syntron, for primary telescopic crowns. So this is my setup, and it grew 13 years ago and still works. I just don't use the scanner, the MAP 300, because it's really slow. And that's the way we work now. So this is the material we had in the end of 2019 that was available. So a lot of stuff, but this isn't necessary to have in the lab. What I use now is this, and I think I made some decisions how much of this material I use, and about Ceramill ZI I use about 5%, Zolid FX multilayer about 25%, and what I really use a lot in the last 3 or 4 months is Genics, and you will see why, and you see also a lot of cases here which I show you, a lot cases with Ceramill Zolid HT Plus. As Barbara said, HT Plus is the same material than Zolid Gen-X, but Gen-X is multi-layer HT Plus. So about 4 months ago, Gen-X wasn't available for me. So a lot cases you will see here is HT Plus. Let's start with a case here. I think it's very important to have a diversity in the decision which material you use. Some all-day work like this for fully anatomic crowns, I love to do in Zolid FX multilayer. On the scanner, I scan the model nice, and I do fully anatomic design of these crowns, and then we mill it out, and it's quite impressive how these crowns look in the mouth like. Look at this. Here's the natural canine, and the 4 crowns in the rear, they look just like nature. And it's so easy to achieve this result. The next case where I use Zolid FX multilayer in combination with Ceramill ZI is much more tricky case. So this is the beginning. A patient is 18 years young, a very beautiful young lady, but she has some teeth problem, as you can see. The docs in the clinic of Tübingen made a maxillary rearrangement osteotomy, which means they cut off the upper jaw near the roots, and they position the upper jaw more facial, and they fix it again with screws. And then they cut off the lower jaw, take a part off, and fix it more on the back so that the bite gets normal. After that, the girl has a lot of orthodontics, and also some teeth had to be removed because they're baby teeth, milky teeth, and they're not able to be part of this reconstruction because the roots are too short and will not be able to take these bridges. So these are the teeth that remain. All the others had been baby tooth. So a lot of implants had to placed inside, that there are enough ways to cement this work. 4 implants in the upper jaw and 7 implants in the lower jaw are inserted here, as you can see. And after half a year, I got the impression all these implants are Xyph implants, and I am happy that I have these implants in my ExoCAD, so I can design them fully digital, don't have to do this manual, and I design individual hybrid abutments, and I mill them, and then I do the construction of the bridge and of the single crowns. So these are the hybrid abutments. I mill them in Ceramill ZI because inside of the tooth it's opaque, so I don't need translucency inside. I really love it that there is this high opaque material, and I use it for every abutment we do in the lab. This is the construction of the posteriors. I scanned the anteriors, and this is all Ceramill Zolid FX multi-layer with a little bit of ceramic on the labial side that it looks nice. Even internal structure like mamelongs I layered inside, and then I put some enamel on. That these mamelong structures are inside the teeth. That's important for me. So very good function, which is important when I do full mouth reconstructions, that there are very good occlusal contacts. And this is the way I deliver it to the university, and they put it in the mouth. That's a lot of work because a lot of parts and a lot of implants, and it all went out very good. You see the case in the mouth right after cementation, and now look how she looks like. It's a little bit of life changing for this girl because she wasn't able to laugh and smile because she was so unhappy with her old teeth, and now look like she's smiling. She really enjoys it, and we really enjoyed the photo session. So this is the doc from the university. This is me and the patient. Okay, impressive case. And another case I want to show you are also some Zolid FX reconstructions I did with, and as you can see, these are 3 crowns, and here is 1 veneer. And this veneer is also made in Zolid FX multi-layer. And I always thought this is not good and not a good way, because I always thought veneers have to be in pressable ceramic like lithium disilicate, but it's not true. It's a very good workflow and it looks awesome in the mouth, but it's not that easy to bond it in the mouth. It's very important to have a good workflow for the adhesive bonding of these zirconium reconstructions. Okay, this patient had a very serious bicycle accident. He was not wearing a helmet, and his upper lip was detached, and one tooth number 11, was alveolated, which means it was levered out of the alveolus, and he had been found in the dirt laying there with no reactions, so he had brought to the clinic by helicopter. And in the clinic they first fixed the lower jaw because it was broken, and they fixed the teeth with a little bit of composite here after all the serious injuries got healed. So at this point of stage, I saw the patient first. This tooth was out, was laying in the dirt, and they put them back in the alveolar. It's not the same height than here, but he's very happy that he has his own implant, his own tooth, and not an implant, because he's also quite young, about 20 years young. And we started the reconstruction in this situation. So I made a little bit of smile design to check the new length and the new situation, the new aesthetics. This is a tool I use a lot and I love it. And I do the design here in the computer, and then I nest it, and it's also nice to see how the translucent gradient is shown in the blank before milling. So you got a blank which is A2, A3, and then you nest it up and you get an A2, and you nest it more lower in the blank, you get an A3. Easy, and it works. And if you got a very good workflow, which I have, or which we all have with Amann Girrbach, like design and milling parameters and the burrs work perfectly together, you get these sharp margins like here. Watch out. It's no gaps here on the margin, no missing areas, no chipping on the margin. It's just perfect, very clean and sharp margins. And so they fit here on the model just like perfect. And I'll show you how to finish this work the way I do. There are a lot of ways. I do it like this. First, I put some Mio liquid on the surface of the ceramic. Then I layer all the mamelon stuff with Mio inside the tooth. And then I put some powder of ceramic on it. And then I fire it. And after firing, I do the first layering, which looks like this. Some very little dentin in the cervical area and internal effect masses like mamelon masses and opalescent masses on the incisal area, and an area here to raise the value of this reconstruction. It's very bright. So after firing, I get this result, and then I do the surface structure and a second bake and a glaze bake, and this is the result after glaze bake. So very nice looking here, and a little bit different here in the cervical area, because this tooth, you have to be in remind, was out of the alveolus and put back, and he's in another position than the other tooth. So this is another emergence profile than here. But as you can see on the portrait pictures, it doesn't matter because the patient doesn't show this when he's smiling. What is very important for the adhesive bonding is that the dentist, after he did the try-in, he sandblasts the inside of the crown with 1 bar of aluminum oxide, 50 microns. And after that, you have to put some chemicals inside. It's called Monobond S, which is a zirconium adhesive, zirconium primer. And after that, they can bond it. And this is a technique which Professor Kern in Kiel uses since 15 years, and he did this Maryland bridges with just 1 wing, and he bonds it on the back side of the tooth. And if a unilever bridge works like this, a veneer will last for 1,000 years. So this is a very good way to bond it. It's more different than you just put a cement in and put the crown in. It's you have to work very clean as a dentist to get a nice result like this. So then I put the flashlight in the mouth and was able to take these pictures. Look at this, how natural these teeth look like, almost like grown. Look at the halo, look at the internal mamelon masses, very, very clean and very, very good way. So this is Zolid FX multi-layer on clean teeth dies and a little bit ceramic on top. Get this result. And look, when he's smiling, he shows like this. You also can see here there are some Narben, some stuff because of the accident here. The lip was cut off here and the lip was hanging over there. Terrible. But now he's very happy, and we are very happy because we could give him his smile back and his shape of the tooth back. He said, yeah, that was the shape his teeth had been before, and very good. So next case, also FX multi-layer, posterior bridge like this. And you may, what's this? You may ask, what's this? These are retention preparations, because if you have a bridge like this with a very limited height of the dies, it's very important to have a good retention. And this is a preparation set which will come this month on the market. For dentists, it's just 6 burrs, and they can do a very nice preparation, which is shown here for posteriors and frontiers crowns, and also veneers in the front. Just 6 burrs, so very easy to use, and it's very important for us to get a nice preparation, because if we have enough space and good friction from the crowns on the die, the dentist has a very easy way to cement these crowns in the mouth. And if you have a short teeth like the case I will show you now, it's important that the bridge doesn't lose friction on the tooth, and therefore it's shown that there first we have to do with the Arkansas-Stein and smoothen the preparation. And if there is a limited crown height, like shown here, only 2 millimeters, 3 millimeters, it's very important to do these retentions on the labial side and on mesial and distal approximal to get enough friction on the die for the bridge. As shown, this is the impression. So I do the model work, you see these retentions, and I do the design in the computer, and then this one here is important, that there are these retentions in the zirconium dioxide. And the preparation kit is the diameters of the burrs are designed that the machine can mill this out perfectly. So this is the milled reconstruction before sintering, and then I do a little bit of stain after sintering, and it looks like this. And this is a very important picture for me because it shows when the bridge is holding like this on the die, the dentist is able to cement it with a glass ionomer cement in the mouth, and he does not have to do the adhesive protocol. So think about it, and maybe you can use this technique together with your dentist to get great team success. So this is the bridge in the mouth right after cementations, 5 minutes later, and even looks nice. Okay, let's come to HT+. This is a case with a very bad periodontal situation. The teeth had been in the mouth for a long time and they could be preserved. But now the patient was so unhappy with her aesthetics, she said she wanted to have it beautiful. And the upper jaw, the teeth 1, 2, 2, 4 are teeth, and 2, 5 is an old implant. So as you can see here, this tooth is a pontic. It's only bonded to the central incisive, and the root is not in the jaw again. You see, these teeth are only in the bone here, here, here. So very, very movable in the mouth. They move, and it's no way to hold these teeth. So extraction is the only way. So all the teeth out, all the old implant also. You look here, it's also osseointegrated just in this area. It was screwed out very easy. So these are the extracted teeth from the dog, and then we leave it a few weeks that it's healed nice, and then the 3D design of the implants took place in these weeks where the patient, where the alveolus healed. So we get a guide for implantation, and the dog uses it in the mouth and places the implants on the place where we planned it digital. And after 4 months, he took an impression, and this is what I got in my lab. This is the old implant that remained, and these are the 4 implants that are new. I designed the hybrid abutment on the front tooth and the individual titanium abutments on the posteriors. Then I scanned and designed the bridge and milled them out in Ceramill Zolid HT+. Today I would do this case with Genics because I even have to do less layering ceramic on the labial side than with HT+, because you have change of the color inside the blank. So this is HT+, 1100 megapascal strength, and a little bit dentin and enamel on the labial side, first bake, second bake, and the finished case. I also did a non-prep veneer here on the canine 1-3 to get a nice function. And this is the reconstruction before I deliver it to the dentist. These are 3 zirconium dioxide hybrid abutments, and these are individual titanium abutments, all milled with the Ceramill Motion DNA. The lower jaw, we did 2 veneers on the canines and crowns on the central and lateral lower incisivi. And then the dog screwed the abutments in the mouth, closed them with Teflon. And this is the situation now. And if you remember, this is where we started. And this is what she got. She's very happy and we are happy too. Looks good, works good, and it's very functional because it's high strength. This is the smile before, and look what she looks like now. A little bit life change, she said. Now she smiles much more happier. And this is the X-ray, the upper reconstruction. Yeah, great team success. Okay, here in Germany, we do not do all on 4. Only less dentists do this, but we do a lot more implants, which is good for the patient and good for us. In this case, we have 12 on 12. So this is the impression of the upper and lower jaw. 6 implants in each jaw, 6 in the lower, 6 in the upper jaw. And this is the situation in the articulator. As you can see, there is a lot bone loss in the posterior area, so we have to reconstruct pink and tooth. This is important. And in this case, I use Ceramill Zolid HT+. Works very well, and it's a very perfect material. I was very happy with it, but also this case is also possible to solve this case now with Genics. It's the same strength, and you can also do a nice gingiva work with Genics on the cervical area. This is after milling. You see the fully anatomic milling of this reconstruction and also of the gingival parts. And I take the new formula liquids from Amann Girrbach to do the coloring before sintering. And when I do this with the Gen-X, which I will show you later, also a case with Gen-X, a showcase of Gen-X with white and pink, you don't have to do this, and you save a lot of money because you save a lot of time when you do this with Gen-X. I show you later. So this is directly after sintering. You see the sintering pearls are here in some areas, and it looks very nice and smooth. I love it. And look the way here it looks like. Very clean aesthetics. So I put these bridges in the articulator and check the occlusion, finish the occlusion, polish the occlusal areas, that it's very smooth and fine. And between the left picture with ceramics on and the right picture where there is no color on, there are about 15 minutes. So it's a very efficient workflow when you do it fully anatomic. And I put Miocolor in the tooth areas and also Miocolor on the gingival areas. And then I fire it and I get to this result in very effective way. It took me about 1 day to finish these 4 bridges. This is the reconstruction finished in the articulator. I took off the gingiva mask that you see the 6 zirconium dioxide hybrid abutments, and you see all the very natural looking bridges on it. Some polished occlusal areas, which is important because the antagonist in this case is also zirconium dioxide. It's not that important, but if it's a natural tooth, it's important that their contact points are high gloss polished, as you all know. Here you see the polished areas where the contacts are. Good function, patient feels very happy with this case. Okay, next case. This is a case I did for X, 3 times German kickbox champion. And I was a little bit afraid of this guy because he's 1.90 meters high and has a lot of muscles, but has very less teeth, as you can see here. Almost no teeth visible. In the upper jaw you see nothing, in the lower jaw you see 0.5 millimeter. And if he smiles, it looks like we have to do something, huh? So this is a full mouth case, as you can all see. First we did a splint. I milled a splint with 6 millimeters of more height that he can test it. And he said, hey, I love it. I even eat with this bite splint. And so it's when the bite splint works well, the work will also work well. And what he wanted is bleach too. He was very informed by, I think, Dr. Google, and he checked the tooth colors. And I said, okay, the brightest one is A1, but he said, no, Benny, the brightest one is bleach 1, and I want bleach 1. And I said, hey, no, that's not a good color because it's very, very bright, but he wanted it. And as you can see on the eyes are very bright and very white. And I compare the brightness of the tooth with the brightness of the eyes. If the eyes are more yellow, you can't do, if this area here is more yellow, you can't do a color like this. But it's okay. It's almost the same brightness. So this is intraoral picture, and this is the shade he wanted. So I did all fully anatomic, but not upper jaw on the labial side, because you see his function. He was very worn teeth, very abrasive teeth. So I do all the contact points in monolithic zirconium dioxide, which is very important that he will have a lot of fun with this reconstruction over years, that there is no ceramic which can chip off. So a little bit of dentin, a little bit of mamelon masses inside, some opal masses on the side of the tooth, and you can see this translucent area here. It's also very very bright, but it's not boring. It's not a boring layering. There's inside some effects, as you can see here. The lower jaw is all fully anatomic, no layered ceramics, and these reconstructions on the table finished to get delivered to the dentist. And then he puts them in the mouth, and you see the reconstructions. This is 2 months after bonding, the reconstructions in the mouth. Patient is happy, and he's very happy with the color. He says it's one big opportunity of this bright color. If he has to go to toilet at night, he just smiles, and there is light enough to find the toilet. No, just joke. He's very happy with the color, and I think it's a bright color, but looks good. Some more details. Very healthy gingiva. Great team effort. Great case. Look at the difference. Impressive, huh? Okay, next case. 20 more minutes. I think I'm perfect in time. Case 9. We call it Horseshoe in the south of Germany because it looks like a horseshoe. It's out of HD+. I did not do a big bridge like this in Genics, but it's also possible to do this. Material strength is the same. So this is the bridge directly after sintering. And this is what is possible with very good zirconium and a very good layering system. In this case, it's also Mio. As you may know, I do a lot with Mio because it's a system where you can get this result with just 0.2 millimeters of ceramic. And so the patient has almost no possibility to get a chipping, which is very important. This patient is actually my neighbor where I live, and he's in 85 and wants some fixed bridge, not a removable, and he loves it. This is 1 minute after cementation. You see how it looks like in the mouth. Okay, what I showed you now is some Genics cases. And first I want to show my workflow, what I do with Genics in combination with Mio, because this is the combination I use in the lab. This is Genics A2, fully anatomic milled with some gingiva area, and I want to show you how to achieve this result. So after milling, I do the surface reconstruction with the burrs. You see all these lines here and all the angles. Very nice milled margins here. You don't have to do there anything. And then the aesthetics is all done with Mio with very little thickness of layer. So first I do glaze liquid on the surface, then you wipe it off with a tissue that there is very less liquid on the surface. And here I take shade A on the cervical areas to get more chroma there. It's not the way I work that fast. The video is done faster. I'm very fast, but not that fast. So low value in the incisal area with this mask here, with violet. It's called smoke. And then some mamelon masks. This is the stuff I use here. It's mamelon masks, really high opaque, non-fluorescent mask, which I place in the incisal areas. And this material you layer. It's not coloring, it's layering, like a composite. And you layer all the ceramics in the incisal areas, and you see the color before you fire it, which is very good to control. So a little bit blue here and a little bit blue there, and the tooth are I'm happy with the tooth now. So this is a material which I use for value increase, for more value, for higher value. It's called Light Plus. So here, the video is very fast now. The tooth are finished, and here I use the pink colors for the cervical areas. It's called Merlot, this color, and looks like this. Then you can do some more effects on the cervical area, some more red or blue or brown stain to get a really aesthetic and nature-like look. I fire it up once to fix it all, and then there is a special stuff, it's called structure, and I put some structure on the labial side of the tooth, take the spatula and fix it on the labial side to have it very well adapted on the framework, and then you use a brush and shape it. You adapt it first, and then you shape it. You do the lines and the angles. It's about 0.2 millimeter of thickness of this material. And after firing, it shrinks. It's even less. So after firing, it's maybe 0.1 or 0.15. So it's very thin. So this is an important step. Riffeln to adapt it also even more on the zirconium dioxide frame, and then you can do the details. Here in the cervical areas, some flames. Yep. Okay, and then I fire it. This is structure, first bake of structure on the tooth area, and now I do some structure on the cervical area with a gingiva structure mask. You also adapt it like this. And remember, the zirconium dioxide in this case is not pink in the cervical area. It's tooth-colored zirconium dioxide, and I adapt it here in the same way than you've seen before. And then you fire it up again. And this is a very important step. Before I do the glaze bake, I do the surface structure, and I do it like on natural, like I layered in the normal way when you do the ceramic with a brush on the labial side. And after you did the sorry, something with a video, I did a mistake here. After you grinded it and you did the glaze bake, it looks like this. Okay, so this is a very good workflow, and here's the final case. it's a little bit different workflow. It's not that easy to show in just a few minutes, but I have some courses where I do exactly this case. So this is the showcase, as you have seen, and now you see some patient cases with Gen-X. And this is the first patient case I did with Genics, and it was only tooth color, no tissue, and I did this design. All the palatinal areas are fully anatomical, also the canine and the centrals, no ceramic on the palatinal side, just on the labial side. The tooth number 14 is with Mio on the labial side. Also here there is no layered ceramic. First bake, second bake, glaze bake. You see this result here, and I send it to the dentist, and this is how it looks like. And it's so easy to achieve this result. Just 2 bakes here with 0.6 millimeters layered ceramic on top, and here this is monolithic Gen-X. It's amazing how good this material looks like. And this I call dental porn. It's wow, it's just amazing how these structures look like in the light. When you have the flash from behind, this is all zirconium dioxide, and you see the mamelon structures. These are Knut Miller tooth. You see the mamelon structures just in the zirconium dioxide. It's Gen-X. And this is how it looks like when you put some internal characteristics on the mamelons, and then I use only very little bit of dentin and the rest is enamel, and you fire it and you do the glaze bake, and it looks like this. And this is how it looks like in the mouth, and you see the start picture here. It's unbelievable. Here's the implant, the hybrid abutment here under, and very good aesthetics. I love it. Patient loves it, and also dentist. So this is the third case with Gen-X. I show you now. This is the initial situation. Some old crowns. Patient wasn't happy with it, wanted new smile. And as the dentist took off the old crowns, we have one problem as dental technician, the discolored tooth. And I want to show you how I solve this problem. Earlier, I would have used different materials, but now I use Gen-X, and I put some opaque material inside the crown before sintering, and this material opaques the crown on the inside. Very nice prep of my dentist, and I scanned it and designed it. As you see in all the cases here, all the functional areas on the palatinal side are fully anatomic, and I mill them out in 2 different Gen-X blanks. This one is A3 for the canines, and this one is A2 for the lateral and central incisive. And this is the framework after milling. This is another cutback form, which I use when I do less layering than with the Knut Miller teeth. So here is only 0.5 millimeters of layered ceramic on the labial side, and the canines are monolithic in the way I showed you in the video. So this is underneath, here is Mio Color, and here's Mio Structure, which looks like a composite, but it's not, it's ceramic. And you adapt it with a brush, and you do the surface structure with this brush, and you fire it, and then you grind the surface of this Mio structure, and then it looks like this. This is Mio structure, and this is layered ceramic. It's also from Jensen. It's called ZR, InSync ZR. So I do a little bit of glaze paste on the labial side and some effect masses at the glaze bake, like a halo. I did more halo here, and then I fire it and get this result here. You see the layered ceramic here, and you see the monolithic crown here. This is how it looks like on the model. This is the initial situation, and this is what we achieved. It's another way, huh? Great. This is how she smiles and how she's happy with it. It's very happy. Okay, next case, case 13. We have 2 more cases. Single implant with Zolid Gen-X. I show you. And I said in my beginning, I still use Zolid ZI, which is the opaque white material. And I show you in this case, whenever I use an implant, I use ZI. So this is the old crown on tooth number 21 here. This is a crown. These are natural teeth. And this crown has a problem because it's broken here. As you see on the X-ray, it's broken here. And this is, you can't hold this teeth. It has to come out. No way to solve this problem. So this is the broken root. And with the Benex extractor, you can remove this root without damaging the bone in this area. An implant is inserted. This is from Camlock. The implant is called Cone Lock. It's a conical implant. And what my dentist does very well, he uses the old crown, etches it, the ceramic, and etches the natural tooth, and then he bonds the old crown in. So he does not have a provisional. He uses the old crown as the provisional. Very good way, very effective. So after 3 months, we did the reconstruction. Therefore, the doc needs to do the impression, and I do the model job. And as you can see here, this is the diameter of the implant, and we have to be here at the red line, which is the emergence profile, and therefore I copy the emergence profile of the neighbor tooth like this one. And when you grind it in the plaster, then you scan it, design it, and as you can see here, I milled the abutment out of Ceramill Zolid ZI white, and I milled the crown in the same, just right after each other, in the same machine out of Genics. And after sintering, I have the titanium base, and I have the abutment out of ZI, and I have the crown, and look how they fit. It's unbelievable. 2 blanks, 2 different shrinkage factors, and after sintering you have this result. It's just perfect. You don't get this result when you do it in 2 steps. When you first do the abutment and then you scan it in and design the crown, I don't get this fitting. If I do a maximum zoom with the iPhone, you get this fitting here. It's just perfect. It's not imagined to get it better. It's perfect. So here a little bit fluor modifier on the labial side, and then I do the layering of the ceramic here. I try to copy the effects of the natural tooth, which is very tricky in this case because it has a lot of gray and yellow here inside, and no ceramic on the palatinal side and on the approximal side. So this is the first bake. I did a correction and then send it to the doc, and this is the crown in the mouth directly after cementation. And this after 2 weeks, I could make these pictures from the lateral and from the frontal, and with a black ground. Yeah, it's a good result and very stable. I think this is the last case. Implant bridge out of Zolid Gen-X, also designed all at once. If you follow me via Facebook or Instagram, you may have seen this case because I showed it yesterday or the day before. I think on Monday I showed it. I can't remember. A few days ago. 2 conical implants, also cone lock. In this case, cone lock implants. And this is the construction, the finished abutments and the finished crowns, all designed all at once. And this is a very efficient workflow for me because it's perfect. You get such a perfect fitting and very efficient and very, very precise margins. So ZI white blank for the abutments, and for the bridge Gen-X. Directly after sintering, I just put it in. There is no adjustment, no grinding on the abutments, no adjustments here to achieve this result. This is just out of the oven and inside, and it fits like this. And what is very important that you do when you do these cases, that you work very clean and very clean, that there is no plaster which touches here the abutment. Very clean workflow is very important, but when you do it, then you get this result. So this is before layering ceramic. I did 2 bakes. This is the framework. First bake, shrinkage, second bake, and before glaze bake and after glaze bake. And watch this result. I love it. Here the control model, very good fitting, very nice margins. Look at this. That's perfect. So this is now at the dentist, and he will put it in the mouth at the end of this week, and I'm very excited. These are my contacts if you want to follow me on Instagram, Facebook. I'm very happy, and I hope you have enjoyed my session here. And if you have any questions, just let me know.